really do. So, guys, welcome back. Sorry for the long break. I was posted in the ward, in the flu ward, and it was a bit difficult for me to come up with content. But here I am. We're going to speak about the paranasal sinuses today. Don't you dare watch this video if you haven't watched the nose already, because this is a continuation of that. This is what we're going to be speaking of. We're going to define it, then have a single slide stating functions and features. Then we're going to classify them, and every sinus has been converted into a beautiful table on a slide thanks to one of my students, Varun Pathak. So a big shout out to him for making those lovely tables, of which you can keep screenshots. And the tables will be discussing location, size, shape, measurement, vascularization, innervation, and where they open, and their developmental features. And there will be slides or pictures that would show you the relations, just to get a basic idea. This can only be asked as a short note, so I'm not stressing on too much information about everything in detail. And then a quick note on the clinical anatomy. Right? Now, paranasal essentially means around the nose. So these are hollows in the bony substance of the bones that contribute to the nasal cavity. Now, you've already seen that in the previous lecture. So, what is a sinus? A sinus is a hollow space. So that's what paranasal sinuses means, and it adds a certain lightness, or it reduces or subtracts the heaviness of the skull bone. So it adds a certain amount of airiness and lightness to the skull, thus making it lighter. This also contributes to what is known as vocal resonance. Like I told you in the previous lecture, if the nose is blocked or the paranasal sinuses are filled with inflammation and discharge, then you're going to end up sounding like this. You're going to end up sounding weird. So that's the vocal resonance part, right? Air conditioning. Every time you breathe the air inside, it's going to be nicely distributed inside these hollow air spaces. Thus, it is exposed to a higher surface area, which can help in conditioning the air. By conditioning, I mean it can add some humidity, it can slightly make it a little closer to the temperature within the body. So no matter what is the temperature of the air you're inhaling, it will be conditioned to a more suitable temperature. And finally, it helps in the growth of the facial skeleton. As the sinuses grow, as the air spaces grow, so do the facial bones, thus making your face grow in a particular way. Features: all the paranasal sinuses open into the nasal cavity. They all open into the lateral wall of the nose. I'm not going to discuss that again. You already know that. They are all lined by respiratory epithelium, that is pseudo-stratified ciliated columnar epithelium. Okay? I hope you understand what pseudo-striated means. I hope you know what ciliated means. I hope you know what columnar means. This is not a histology lecture. Trigeminal nerve is responsible for the sensory innervation of all the sinuses, and the sinuses typically have two growth spurts, one that occurs at the age of 7 and the other that occurs around the age of 13-14, when you hit puberty or when you hit adolescence. Okay? Great. Moving on. Paranasal sinuses. Very nicely you can see the different sinuses here. That's the frontal sinus emptying somewhere over here. This is the maxillary sinus on either side emptying somewhere over here. Light green is the ethmoidal air sinus, and pinkish orange is the sphenoidal air sinus, right? And this bluish thing is essentially the nasal cavity, and you can see the typical external nose formation happening here. Okay, there's 4: frontal, maxillary, ethmoidal, and sphenoid. Another classification is an anterior group, that is the sinuses that drain in the middle meatus, and a posterior group, that is the sinuses that drain in the superior meatus. The ones that drain in the superior meatus are essentially the sphenoidal air sinus, which actually opens even above in a region known as the sphenoethmoidal recess, and the posterior ethmoidal sinuses that open in the superior meatus. Alright, let's have a look at the frontal air sinus. Okay, here's the frontal sinus. Let's talk about the relations. Anteriorly you have the supraciliary arch over here. Posteriorly you have the frontal lobe along with the meninges, and inferiorly you can see, technically you have the orbit, but since we are at a paramedian position, you can now see the anterior group, anterior ethmoidal sinuses right here. Okay, where is it opening? It's opening here into the frontonasal duct. Take a screenshot. Location, frontal bone, superior to orbit. Measurements, you can see that. Vertical, transverse, anteroposterior. Blood supply, supraorbital and supratrochlear vessels. Both are branches of the ophthalmic artery, which is a branch of the internal carotid artery. Nerve supply by the supraorbital nerve, branch of the ophthalmic nerve, which is a division of the trigeminal nerve. Opening in the anterior part of hiatus semilunaris via the frontonasal duct. And development, important MCQ, the frontal air sinus is the only sinus that is absent at birth and starts developing at 2-3 years, reaches the full size between 15 to 20 years. The ethmoidal air sinuses, it's divided into 3 groups. Now, you wouldn't really call it a paired sinus. This is probably the only sinus for whom you would not use the word paired, because the ethmoidal is a singular bone, and on either side of the midline, in the midline you have the perpendicular plate, as you know, on either side is the labyrinth. So we just divide it into anterior, middle and posterior air cells. Anterior is about 1 to 11 air cells, middle about 1 to 3, posterior about 1 to 7. Blood supply, anterior and middle by the anterior ethmoidal vessels, posterior by the posterior ethmoidal vessels. Nerve supply is the same as the vessels. Opening, the anterior ethmoidal air cells open somewhere in the middle part of the hiatus semilunaris. The middle air cells open into the prominent bulla ethmoidalis, which you already know by now, and the posterior opens into the superior meatus. The development, as I mentioned in the earlier slides, it has 2 spurts, one at around 7 to 8 years, the other at about puberty. Let's have a look. This is the anterior group. It will be opening somewhere over here in the hiatus semilunaris in the middle region. This is the middle group. It will be opening into the bulla, which cannot be seen here because the middle concha has been cut off, right? Somewhere over here is where it will open, and the posterior group will open somewhere over here in the superior meatus. Okay? You probably have seen that in the lateral wall slide. This is a superior view of the nasal cavity. Lateral to that are your anterior, middle and posterior ethmoidal air cells. Lateral to that is the orbit, and posterior to the ethmoidal air cells is the sphenoidal air sinuses. You can see the paired sphenoidal air sinuses here. That is also going to be our next slide. What are the relations of the sphenoidal air sinus? Now I want you to be very familiar with this diagram and practice it, because this is essentially the diagram of the cavernous sinus with all its relations, lateral and medial, and here you can see the pituitary gland. So the relations of the sphenoidal air sinus are very simple to remember if you know the cavernous sinus relations, right? Please note how intimately it is related to the internal carotid artery. Present in the body of the sphenoid bone posterior to orbit. The dimensions are given. The blood supplies by the posterior ethmoidal artery and a couple of direct branches from the internal carotid artery. The venous drainage is into the pterygoid plexus of veins, and of course the cavernous sinus that is right adjacent to it. Nerve supply by the posterior ethmoidal nerves. It opens into the sphenoethmoidal recess above the superior concha. Development is the same as the others. Now let's have a look at the maxillary air sinuses. This one is a bit important. It lies inferior to the orbit, and it is pyramidal in shape. It has a floor, a roof, a base and an apex. Okay, so the floor is essentially the part of the maxilla that is contributing to the hard palate, correct? And then you're going to have all the upper teeth that are just going to be related inferior to it. The roof is formed by the inferior aspect of the orbit. The base is formed by the lateral wall of the nose, and the apex is essentially directed towards the zygoma, the zygomatic arch of the zygoma. Okay, this is the opening, and you already know that it opens into the middle aspect, or rather the posterior aspect of the hiatus semilunaris of the middle meatus. But you can see that since the opening lies at a level higher than the sinus itself, natural postural drainage is difficult and so we have a separate slide on how to drain the maxillary sinus. This is your table. It's also known as the antrum of Highmore. It is pyramidal in shape. It is the largest paranasal air sinus. Blood supplies by the anterior, middle and posterior superior alveolar arteries. Venous drainage is in the pterygoid venous plexus. Nerve supplies anterior, middle and posterior superior alveolar branches of the infraorbital nerve. The infraorbital nerve is the maxillary nerve after it enters the foramen rotundum and travels anteriorly. Opening is in the posterior part of hiatus semilunaris, and as you can see, it is a disadvantage for natural drainage because it is on the upper aspect. Sometimes there is also an accessory opening which is about in the same level but slightly anterior. It's the first maxillary sinus to develop. That's an MCQ. It appears at around the 4th month of intrauterine life. It's rudimentary at birth, enlarges rapidly during 6 to 7 years, and becomes fully developed at puberty. That's a view where you can see the maxillary sinus of the left side from the left lateral view. And here you can see the opening. Okay, it's going to open into, this one is going to open into the left lateral nasal wall. Okay, you can see how the roots of the upper teeth, especially the molars, partly the canines, are very closely related. Most times they are separated by a very thin plate of bone. Sometimes there may not even be well developed bone and direct mucous membrane, which is why infection of these teeth can spread to the maxillary sinus and cause maxillary sinusitis. It's going to be a painful condition which is characterized by pain when you press on the frontal aspect of the cheek, on the anterior aspect of the cheeks. So a slide just quickly showing all the paranasal sinuses. This is the orbit, this is the frontal sinus, this is the nasal cavity. Over here you have the ethmoidal air sinuses, and over here you have the maxillary sinus opening over here like that into the middle meatus, right? This bone is the inferior nasal concha. Okay, so this is the superior concha. Above that you can see how the sphenoidal air sinus is opening. Okay, then this is the superior meatus where the posterior ethmoidal cells, posterior ethmoidal air cells open. The middle concha is cut, so you can see the middle meatus. See this bulge? That's the bulla. Here you can see the openings of the middle ethmoidal air cells, and just below the bulla you can see this little groove, that is the hiatus semilunaris. At the posterior end of the hiatus semilunaris you have the opening of the maxillary sinus. Then you have a couple more holes over here which are essentially the opening of the the anterior ethmoidal air cells. And you can see how there is a probe passing through the infundibulum that goes all the way through the frontonasal duct to open into the frontal sinus. Okay, that's where the opening of the frontal sinus is going to lie. Correct? Trigeminal ganglion and its 3 divisions. Ophthalmic. This is the posterior and anterior ethmoidal nerve. The maxillary division going through the foramen rotundum, and continuing as the infraorbital nerve. This is the posterior superior alveolar nerve, and this is the middle and anterior superior alveolar nerve. Okay, clinical anatomy. Now, sinusitis is inflammation of the sinuses. You already know the relations, so you can now start applying yourselves and you'll realize that frontal sinusitis would present with pain in the forehead region, right? Also, frontal sinusitis typically starts in the morning, enters the peak in the afternoon and subsides by evening. So it has a characteristic term known as office headache. If frontal sinusitis gets complicated, be aware that it could eventually spread through the frontal aspect of the meninges and cause a frontal lobe abscess. However, that's a very late complication. Maxillary sinusitis we'll be speaking about more on a separate slide. Sphenoidal sinusitis, again, if it gets too serious, it could directly communicate with the cavernous sinus if there is bony erosion. So you just have to read the cavernous sinus inflammation and you'll automatically understand what all happens in that because of all the important lateral relations. That is for a different lecture, but remember that the cavernous sinus and its clinical anatomy is extremely important. Ethmoidal sinusitis would be presenting with pain in the medial aspect of the orbit, and it would affect the orbit and the eyeball and the extraocular muscles as it progresses. When we discuss the radiology, there are two different views that we consider in X-rays. Waters view, where the plate and the orbitomeatal line make an angle of 45 degrees. The orbitomeatal line, as you can see in the slide, is a line that passes through the orbit and then the external acoustic meatus. Okay, so that's making an angle of 45 degrees with the radiographic plate here in case of Waters view. And in the CALDWELL'S radiographic view, the orbitomeatal line is perpendicular to the radiographic plate. So these two are the views that we use to observe the paranasal sinuses. Let's have a look at what they look like. So you can see here, Waters view, frontal sinus, the bony nasal septum along with the nasal cavity on either side. You can see the maxillary sinus here, and you can also see a little bit of the sphenoidal air sinus, but that's better appreciated when the mouth is opened. And you can see the orbital margins here, and that's CALDWELL'S view. Here you can again see the orbital margins nicely. The frontal sinus is better appreciated here as compared to the maxillary sinus. And that's a CT scan coronal section showing the paranasal sinuses. This is the maxillary sinus of the right side, and on the left side maxillary sinus you can see pus or some kind of an exudate that's kind of filling, and if you want to drain it, it has to fill all the way here and then come out. Instead of that, we could just puncture it from here. So let's see how to drain the maxillary sinus. Before that, the sagittal CT scan. You can see the frontal sinus here and the sphenoidal air sinus. The arrows are pointing towards the hiatus semilunaris. This is the maxillary sinus. Once again, let's have a look at the relations. Superiorly, the orbit. Laterally, if it swells this side, then the cheeks will show a swelling. Medially, it is basically related to the lateral wall of the nose, where also lies its opening in the middle meatus, and inferiorly it's related to the upper molars, right? So in case of a maxillary carcinoma, depending on the direction of its enlargement, the following structures will be affected and show enlargement and involvement. Now if you want to drain the maxillary sinus, you can either enter from here, from the palate, or you could enter from the gingiolabial sulcus. So this is known as antrostomy or antral puncture, and this is known as the Caldwell-Luke surgical approach. This is the gingivolabial sulcus, right? The point where the lip mucosa becomes continuous with the gum mucosa. So in this area you can make a little window, as you can see here, and it directly enters into the maxillary sinus. So that's how you can drain it. Finally, another way to approach the maxillary sinus is by blasting a bomb in front of someone's face. As you can see, Gus Fring from Breaking Bad and Harvey Dent from The Dark Knight Rises. You can see their maxillary sinus if you observe closely. Thank you so much for watching. See you in the next one. Bye-bye.